Hey guys, welcome back to this YouTube channel. In case you're watching this video for the first time, please consider clicking the subscription button. Our returning subscribers, thank you very much for always clicking in. Don't forget to comment, to share, to like the video, and the most important thing, don't forget to turn your notification bell so that every time I post a video, you will be the first person to be notified. Straight away, I'm going to talk about the functions of the placenta, and before that, let us review what is placenta. And in this video, we are going to look at so many things that you have been asking me about placenta. So let's get into the video. So placenta is a temporary organ that connects your baby to your uterus during pregnancy. Placenta develops shortly after conceiving and it attached to the wall of the uterus. Your baby is connected to the placenta by the umbilical cord. Together, the placenta and the umbilical cord act as baby's lifeline while in the uterus. So let us see some of the functions of the placenta, because most of you usually just think that placenta is just there. It doesn't have its function or during pregnancy. But let us look some of the functions. So it protects your baby. Yeah, and that is the first point. It protects your baby in that any germs, any foreign substance, placenta collects it and it doesn't get into your baby. The next point, it help to provide the oxygen and the nutrients. You breathe the oxygen, you breathe in the oxygen, placenta take the oxygen to the baby. You eat the food, placenta, your baby will get the nutrients through the placenta. Vitamin, carbohydrates, proteins, all those nutrients that your baby might need inside your womb, the placenta is the one that will take it. Now, in short, I'm saying it helps in gaseous exchange. It takes out it takes out carbon dioxide and it provide the baby with the oxygen, and at the same times it nourish your baby with nutrients, the needed nutrients. Another point is that it's remove harmful waste and any harmful waste from the baby, like carbon dioxide, any harmful waste from the baby. Placenta is the one that remove it. It also provides the hormones that help the baby to grow, and also it provides hormones that help to maintain the baby, the pregnancy. The pregnancy is maintained with some hormones, and those hormones are produced by the placenta. So it helps the baby with, or it produces hormones that help the baby to grow, and also hormones that maintains the pregnancy. Another thing is that placenta possesses immunity from you to your baby. Yes, it possesses immunity from you to your baby. So we are also saying that it helps in protecting your baby, whereby it acts as a barrier against harmful substance to your baby. Yeah, it protects the baby by acting as a barrier against harmful substance to your baby. So I think those are some of the functions of the placenta that are important, that you might need to know if you're a student. That is a common question. State functions of the placenta. You will state them and explain them. How does those functions come about? So what does the placenta form? What does the placenta form? Placenta begin to form after fertilized egg implant into your uterus, and that is around 10 weeks. And we said that placenta produce some hormones, and before when you want to get a pregnancy results that are positive, we usually say that you should take a test after 14 days. This is when the placenta has started to produce this hormone in your blood and in your urine. And now that at that point when you take the test, if you want to do a pregnancy test, that is the time that you can get a positive result. Placenta continue to grow throughout pregnancy to support your baby, yes, and the placenta starts as a few cells, and it grow in several inches and long. Another thing that you have to know, how does placenta take over? The placenta takes over hormone produced by the end of the first trimester. That is a 12 week of pregnancy. Up until this time, the corpus luteum, which is in the ovary, handle most of the hormone production. I know, because I said placenta produce some hormone that maintain pregnancy. You will be asking yourself now, from the time you conceive to the time the placenta will take over, how does pregnancy maintain at that point? Corpus luteum produce hormones that handle the pregnancy before placenta start taking over. So many people first trimester symptoms of nausea and vomiting, fatigue go away once the placenta takes over in the second trimester. So most of the pregnancy symptoms that we usually experience when you are pregnant, most of the time, especially nausea and vomiting and then fatigue, they usually go away after when you reach the second trimester, of which I don't know if it is true, because the pregnancy, it's tiresome throughout. It is tiring throughout. So maybe nausea and vomiting can go away if you step into the second trimester. But about the fatigue, that one is, I think it is not true, because fatigue, you will get it throughout your pregnancy. Yeah. So this is also another question that I'm going to answer. Does the placenta move? Sort of. I'm saying sort of because the placenta appear to be move only because the uterus expand as the pregnancy and fetus grow. So your healthcare provider will look at the location of your placenta during the first 20 weeks. Anatomy ultrasound will remove or will determine the result. If the position may cause complication, most placenta move to the top or side of the uterus by 32 weeks. Yeah, that is what I can say. So where does the placenta form? The placenta can form anywhere in the uterus. It develops wherever the fertilized egg implant into your uterus wall or your uterine wall. Some position of the placenta are the posterior. The posterior is at the back of the uterus. Anterior is also one of the position of the placenta. Fundus is just up above the uterus. And also we have lateral. The placenta grow at the right side or the left side of the uterus. Yeah. So the placenta can move until about 32 weeks of pregnancy, and it is common to have a placenta that move upward. Placenta that move upward and away from the cervix as your baby gets bigger. Yeah, placenta should not implant itself at the lower uterine segment, because it also can bring complication, and you know that very well. Placenta previa can set in if it is at the lower portion of the uterus. Yes, so placenta look like a disc bumpy tissue rich in blood vessels. You know the reason why blood vessels, because it supply the baby with the blood, making it appear darker at the term. So most of the mature placenta tissue is made up of blood vessels, and they connect with the baby through the umbilical cord and branch throughout the placenta disc like the limbs of the tree. So you see the way, that is how placenta look like. Placenta, we have said the color has two sides. We have the side attached to the uterus, the side is closer to the baby, and the side attached to the uterus or to the uterine wall is deep red blue color, while the side facing the baby is gray in color. Yeah. How big is the placenta? The placenta, by the time you are delivering, it is a sixth of the weight of the baby. If your baby is 5 kg, then the placenta will be a sixth of that. That is the estimated weight. But also you can take a weighing machine and measure the weight of the placenta if you want. Yeah. So we have other conditions that are related to placenta. Those are serious conditions that maybe I will talk about them in details, like placenta previa, placenta creta, placenta abruption. Those are conditions that maybe I will talk about them in the next video. So if you're watching this video for the first time, click the subscription button, leave a comment what you want me to talk about. Let's meet in the next video. Bye till next time.